Okay, so now we are going to look at traits of nervous system. There are two types of the traits. One are ascending traits, another one are descending traits. Ascending traits are sensory and descending traits are motor. And in these states, there are neurons, first order neuron, second order, and third order neuron. Only difference between these neurons is their location, and then they dissociate or cross over in the traits and get the opposite side of the body. Like okay, so as we can see here, there are first order neuron from sensory receptors to the dorsal root ganglion, and from dorsal root ganglion there are second order neuron goes up into the brain, and in this way there are first second order neuron and there are also third order neuron. Like if there is first order neuron from receptor to the dorsal root, and then from dorsal root to the thalamus, second order neuron and third order neuron goes into the somatosensory cortex. So in this way these neurons are arranged in such a way in the brain that it gives first, second and third order neuron. Okay, first order neuron, second order neuron, and third order neuron in arrangement of the tracks. What is the difference? Difference is only of the location when these neuron where these neuron ends. Decussation is a crossover of the neurons and the right hemisphere decussate into the left side of the body and control left side of the body in this way. Okay, as we saw, first order neuron have dorsal root. First order neuron are ends into the dorsal root ganglion, and second order neuron decussate while third order neuron ends into the thalamus. Ventroposterolateral nucleus of the thalamus there is in the cortex. Okay, now there is anterolateral spinothalamic tract which controls pain and temperature, and delta fibers, C fibers, and class 3 4 dorsal root fibers are there. They have primitive system, low velocity, low myelination system. Spinothalamic tract goes through the entire length. Now we will be looking at anterolateral, which controls pain and temperature. Anterolateral. Okay, as we can see, first order neuron from dorsal root ganglion up to the decussation point, and second order neuron from decussation point up to decussating and into the thalamus, and from here third order neuron is there. So in this way, anterior ventral controls crude pressure and crude touch in anterolateral. Ventral spinothalamic tract ends into lumbar region. Lateral spinothalamic tract controls pain and temperature, and lesion in lateral spinothalamic tract there will be pain, temperature, information loss, and it will result into the loss of pain and temperature in the contralateral side. So in this way you have to keep this in the mind. And then comes dorsal column medial lemniscus system. Dorsal column medial lemniscus system, class 2 fibers, A, beta dorsal root fibers are there, and modern system में high velocity and high myelination, fasciculus cuneatus and gracilis are found in there, and its function is 2-point tactile discrimination and stereognosis, recognition of object size is there for the dorsal column medial lemniscus system, and consciousness proprioception, limb points, and sense of position, sense of fullness of bladder is controlled by dorsal column medial lemniscus system. If there is lesion, it results in loss of position, sensation, vibration, 2-point discrimination, because it controls 2-point discrimination typically dorsal column medial lemniscus system area. Like Romberg sign is also distinguished between lesions of dorsal column medial lemniscus system. So in Romberg sign, what happens during Romberg test? They remove the footwear and ask the patient to stand and close to the body. Then ask the patient close the eyes. Doctor will observe that the patient cannot maintain the balance, and doctor may push slightly to see how well patient can regain the balance. So in this way, Romberg sign will be positive in dorsal column medial lemniscus system. So in this way, patient can it is tested to assess the balance, proprioception, sense of joint position and movement. Romberg sign positive, patient becomes unsteady and loses the balance when they close their eyes. So in this way, Romberg sign become positive.